Chronic obstructive pulmonary disorder, otherwise known as COPD. COPD is a chronic obstructive lung disease, which often is not completely reversible. COPD is caused by the inhalation of inflammatory irritants which damage the lung, the most common of this being cigarette smoke. In the United States of America and in the United Kingdom, those who had COPD were made up of 80 to 95% of people who smoked or previously were smokers. However, other environmental factors have also been known to cause COPD, such as air pollution from burning coal and other biomass fuel, such as wood and dung, high levels of dust present in workplaces, such as coal and gold mines, and even the fumes generated during welding can lead to COPD. The most common symptoms are a chronic cough, which is often the first to develop, sputum production, and also shortness of breath. This shortness of breath worsens over time and also during times of physical exertion, and this is due to poor airflow from emphysema, with scarring and narrowing of the airways contributes to the inability to fully exhale. Those inflicted with COPD may find that breathing out takes longer than breathing in. This can, on occasion, lead to a feeling of chest tightness, and even in some rare cases, COPD can result in high blood pressure on the lung arteries, which can strain the heart. COPD is easily the most common lung disorder, and there is still some that isn't known about it. It's argued that some people do have a genetic disposition to developing it. In Mrs. Mack's case study, she mentioned that she does not have a chronic cough, however, she does experience severe dyspnea, describing it as if she wants to gasp to keep living. Mrs. Mack also has cardiomegaly due to the hypertension from the reduced airflow. This is probably caused due to the scarring that was mentioned during the case study.
Bronchitis is usually caused by viruses and exposure to substances that irritate the lungs. Bronchitis is a respiratory disease in which the mucous membrane in the lungs' bronchial passages becomes inflamed. As the irritated membrane swells, it narrows the tiny airways in the lungs. Signs and symptoms include wheezing, low fever, chest tightening, sore throat, and more. One of the main symptoms of acute bronchitis is a cough that lasts for several weeks. This is due to inflammation of the bronchial wall, which causes increased mucus production. For Mrs. Mack, bronchitis is not a permanent condition. It is simply due to her already weakened respiratory system that she is especially susceptible to this illness. Sciatica is caused by irritation of the root of the lower lumbar spine and usually affects one side of the lower body. Often, the pain extends from the lower back all the way through the back of the thigh and down through the leg. Depending on where the sciatic nerve is affected, the pain may also extend to the foot or toes. Symptoms include lower back and hip pain, constant pain on one side, difficulty moving the leg or foot, and a shooting pain that makes it difficult to stand up. The use of heat and ice can alleviate the pain in the initial phase. Anti-inflammatory drugs such as ibuprofen can reduce inflammation. If the pain is severe, a steroid injection can be used. Mrs. Mack suffers from cardiomegaly. This involves enlargement of the heart and abnormal functioning. The cardiac muscles start working harder as the heart muscles pump at an increased rate, leading to physical discomforts and respiratory difficulties. It is usually the result of high blood pressure. As Mrs. Mack also suffers from high blood pressure, this is a realistic cause. The heart has to pump harder to deliver blood to the body, enlarging and thickening the muscle. High blood pressure can also cause the left ventricle to enlarge, causing the heart muscles to weaken. High blood pressure may also enlarge the upper chambers of the heart. Shortness of breath, leg swelling, weight gain, fatigue, and heart palpitations are all common symptoms. Hypertension is the elevation of blood pressure that causes organ damage and results in increased morbidity. Blood pressure is the product of cardiac output and systemic vascular resistance. High blood pressure results in blood flowing through blood vessels at higher than normal pressures. You are able to have high blood pressure and experience no obvious symptoms until you experience a stroke or heart attack. In some people, severe high blood pressure can result in nosebleeds, headaches, or dizziness. Type 2 diabetes is a progressive condition in which the body becomes resistant to the normal effects of insulin and gradually loses the capacity to produce enough insulin in the pancreas. Fatigue, increased thirst and urination, an increase in hunger, weight loss and blurred vision are common symptoms. A healthy diet and medication can be used to bring blood sugar under control.
Based upon the GOLD, Global Initiative for Chronic Obstructive Lung Disease guideline, Mrs. Mack would be rated as a 4, being very severe, and would therefore receive treatment and therapy based upon this rating. Initially, Mrs. Mack's treatment would have involved reducing her exposure to environmental and occupational risk factors, such as irritation when walking up steep slopes, during humid weather, and during exercise. It would have also involved receiving yearly influenza vaccinations, especially in relation to her predisposition to contracting pneumonia. Currently, Mrs. Mack's treatment involves both short-acting and long-acting bronchodilators, administered through an inhaler and a nebulizer. Long-acting B2 agonist bronchodilators activate B2 receptors, which therefore release the enzyme adylate cyclase in the airway smooth muscle. This increases intracellular cyclic adenosine monophosphate, CAMP, which promotes relaxation of bronchial smooth muscle. This treatment would provide Mrs. Mack with bronchodilation for 12 or more hours and is used twice a day. Positive effects of Mrs. Mack's bronchodilation treatment includes alleviation of respiratory symptoms, which includes the ability to perform her usual daily activities, and reduction of breathlessness over 24 hours, the prevention of disease progression, and prevention and treatment of exacerbations. Although common side effects of this treatment involves the cardiovascular and central nervous systems, this could manifest itself through adverse effects such as tachycardia, premature ventricular contractions, atrial fibrillation, and palpitations. In the future, Mrs. Mack may receive long-term oxygen therapy. This is the only treatment which has been shown to significantly improve life expectancy for patients with severe COPD, such as Mrs. Mack. Oxygen is usually administered through a dual-pronged cannula provided by concentrated oxygen in a small gas cylinder.
Mrs. Mack has had lifelong COPD. Starting as a young child, the impact of the symptoms would have limited her ability to engage in physical activity, an important part of growing and developing as a child. As a result of her symptoms, Mrs. Mack may also have had limited opportunities to engage in activities with family and friends that required an elevated level of exertion, such as hiking, swimming at the beach, or camping. This places a severe restriction on her choices that she is able to make in her life and her ability to perform basic activities of daily living. Diabetes increases a person's risk of weight gain. As Mrs. Mack's current weight is already at risk of placing extra pressure on her cardiovascular and pulmonary systems, further weight gain as a result of unmanaged diabetes could place further pressure on these systems, resulting in overexertion and the potential failure of one or more of the organs involved. Her COPD symptoms already leave Mrs. Mack short of breath and occasionally dizzy, as a result of lack of oxygen being available to the brain. Combined with fatigue and blurred vision as a result of her diabetes, Mrs. Mack is at risk of experiencing overwhelming dizziness, potentially resulting in a blackout or a fall. Diabetes can also cause an increase in urination frequency. Her ability to maintain and regain her balance is currently compromised by the sciatica she experiences, as the pain makes it difficult for her to move quickly. If Mrs. Mack experiences the need to urinate, the urgency of her movements could add to her current fall's risk factors. Mrs. Mack also has medication whose side effects currently impact on her cardiovascular system and her central nervous system. The impact of these side effects increases the risk of further harm to her already compromised cardiovascular system. Mrs. Mack is currently unable to walk back and forth across a room without the use of her walker and the use of her medication. The impact of this on other aspects of her life is significant. Since Mrs. Mack is currently living independently, as her symptoms progress and worsen, this may reduce her capacity to continue to do so safely. With the potential for her symptoms to progress further, Mrs. Mack's functional capacity depends entirely on the management of her current with lifelong COPD. The development of the co-occurring conditions will have made it increasingly difficult for her to manage with excessive physical activity. As a result, in addition to the limited physical activity, the restricting nature of her conditions will have a negative impact on her own affect, mood, and her mental health. Feelings of anger and frustration are common with prolonged health problems and pain, and can lead to low mood, increased stress, and poor mental health outcomes. If her symptoms are not suitably managed, Mrs. Mack is at risk of developing such further problems. Mrs. Mack's current quality of life is being negatively impacted upon by the development of the comorbid conditions. Due to the combined symptoms of COPD, diabetes, and sciatica, Mrs. Mack struggles with even basic activities such as washing dishes, where she has to lean on the bench with both arms to allow her to complete the task. As part of her treatment, Mrs. Mack must limit her exposure to environmental agents. This means that something as simple as going outside could be a risk factor in the onset of a COPD episode, and severely limits her freedom to make her own choices. This puts her independence at risk.